I'm looking for someone who knows what it's like to live with a chronic autoimmune disease. You see, in 2008, I started having symptoms of what I would later learn was a condition called lupus panniculitis, a rare, silent, somewhat invisible, disfiguring form of lupus, which is a chronic autoimmune disease where my body cells attack healthy tissue in my body. And in my case, it attacks my fat. But I didn't know that at first, right? When I found out I had lupus, I was so scared. And I was scared because the only people I knew who had lupus had died. The sister of a good friend of mine had lupus, and I tutored her whenever she had flare-ups or when she was sick and couldn't go to school. She was such a light and a fighter, but she passed away in 2001. So when I found out, I was scared. And I'd go to my doctor's appointments and I would have so many questions. But there are things that, the doctors just couldn't answer about what it means to be living with lupus. Like, how am I going to be able to pay for treatment for this for the rest of my life? Or how can I stay out of the sun? I'm from the Caribbean. That is impossible. And it was only when I spoke with other people with lupus years later that some of the fear started to dissipate. There are so many survivors with this disease. But my form of lupus is rare, so I'm still hunting for that person who, because of their experience, they could share resources, empathize, and help me minimize some of this fear and stress. Now imagine if after I met with my doctor, he said, Abby, we have someone who has a similar experience or who's taken care of a family member with lupus who you could talk to a little bit more about this. Would you like to talk to that person? And I'd say, of course. And that person might ask me some of the aspects of my life that might prevent me from being able to stay in medical care or take medications. Like, can I afford meds every month? What stresses me out? How do I manage stress? And really help me navigate the complex health system too. That lived experience is so important, but we underestimate the value of that role. In public health, we call that person who has a close understanding of the people they're working with and the community a community health worker, right? Or a peer navigator. That person has trust with the community and is almost like a cultural bridge between the ivory tower medical institutions and the community to help both sides understand each other. I learned about the value of community health workers and lived experience when I started my career in public health at the only organization focused on HIV prevention and care services for women and girls in Washington, D.C. I started as a program coordinator supporting women living with HIV to improve their health through prevention. In that role, I learned the power of sharing our stories to save lives from a powerful woman, Pat Knowles, who herself, a Caribbean woman, created a space where women could get answers about HIV and prevention from other women. Women learned about the importance of staying on HIV medication, on where to go for good reproductive care, about female condoms and pregnancy with HIV, and who the best doctors were for women from other women. And there were, no tokenizing here. People were valued because of their experience. And their experiences outweighed any degree. And women were more likely to stay in medical care because they worked with each other. I learned the mantra, nothing for us without us, because policies and decisions that affect women's lives should never be made without women being involved in the decision-making about those policies. I've had the honor of working alongside community health workers to address complex health issues for most of my career, and there is so much that we could translate about the work that they do across sectors. You see, I train organizations and networks on health and racial equity, on how to design systems so that no one is disadvantaged because of their social position. And as I'm in these trainings, I sometimes hear, we designed this program, but the people who need it most, they aren't showing up. How do we fix this? And my question is always, were people with the lived experience, those same people, were they involved in the design and selection of this strategy, policy, or program? I hear so much rhetoric about all the money that's been invested in programs to reach those who need it the most or to help increase diversity in businesses. I see governments passing whole policies without even including the most affected voices in the decision. until people with lived experience are leading those decision-making processes on the policies that affect their lives, we'll continue to maintain inequities. So if you're serious about this, nothing for us without us. For the CEO who's trying to understand how to create a more diverse, equitable, and inclusive workplace. For the makeup brand trying to create products for a diverse range of skin tones. For the tech company that's trying to understand, how do I improve accessibility for persons with disabilities? Invest in that lived experience that you're trying to attract in your leadership, decision-making, planning, design, promotion, marketing at every stage. So as you're hiring, developing strategic plans, or building policies, legislation, and programs that affect people's lives, whether you're dealing with poverty, education, cancer, racism, technology access, crime, or carnival, how are you going to involve and value lived experience in the leadership and design? And I challenge you, as you think about the stories that you have been hiding from the world, your experiences shape who you are. They bring value and they could change someone's life. Don't be afraid to share them. As I sit for my bi-monthly infusions for lupus, I often wonder how many Black Caribbean women were included in the clinical trials for these treatments. Is this even going to work for my body? I'm still looking for that person who has lupus panniculitis and who knows what it's like to live with this. Until I find them, I'm going to keep sharing my story.